Alabama has the third highest rate of cervical cancer in the United States.
And a UAB researcher who's hard at work to change that. WVTM 13's Carla Wade spoke to her as our project community, highlighting barrier-breaking women.
As a baby, Dr. Isabel Scarinci contracted polio, a disease now almost completely eradicated due to vaccines. Now she shares her story frequently to show people vaccines can prevent cervical cancer and needless suffering.
My journey as a polio survivor motivated me to eliminate another preventable disease.
Dr. Isabel Scarinci is vice chair for global and rural women's health in the Department of Obstetrics and Gynecology at UAB. Here, you see her in a Birmingham Rotary PSA for Operation Wipe Out Cervical Cancer. It's a statewide initiative to eliminate cervical cancer by 2033.
Cervical cancer is the only cancer really today that we can say we can eliminate.
Dr. Scarinci was diagnosed with polio at 8 months old in a tiny Brazilian town just before it became an epidemic. At a doctor's urging, her mother chose to wait before giving her the second dose of an available vaccine. As a result, the disease spread to both her arms and legs, her bout with polio leaving her with a noticeable limp, and her mother racked with guilt.
I am a living testimony of what a vaccination can do. And that's why when we talk to parents about vaccinating their kids and protecting them from a cancer, I wish they could talk to my mom, to see how hard it was for her.
With the political fallout surrounding COVID, it's been harder to get parents to buy into the readily available vaccine against HPV, the virus that causes cervical and other reproductive cancers in both men and women. Doctors recommend the vaccine for boys and girls between the ages of 11 and 12.
Because people associate now COVID vaccine with other vaccines. HPV vaccination, we have 20 years of research. We have millions of kids that have been vaccinated. I think it takes now a lot of education now for parents to understand and see the data that is safe, that's effective, and that will protect their children.
Alabama's cervical cancer rate, the third highest in the country, is further exacerbated due to a lack of screening and a lack of follow-up, especially in low-income areas and among immigrants.
In rural Alabama, we have a lot of chicken plants, or if they lose so many days of work, they lose points. If they lose so many points, they lose their job. So a lot of times there's so much going on that they say, I'll do this next month, I will do this later.
Dr. Scarinci's work has taken her to heavily impacted areas like Chambers County in rural East Alabama and Sri Lanka.
We all can do something. If you're a mother, you can vaccinate your kids. If you're a business owner, you can let your employees take time off to get their kids vaccinated.
For Dr. Scarinci, her role in prevention is personal.
As women, we are the role models. We are the ones who get our husbands or men to the doctor. So actually, there is even a greater opportunity for us to be role models and for us to tell, the generation that's coming behind when they say, what is cervical cancer?
And crucial in safeguarding the next generation against a cancer we could easily wipe out for good. Carla Wade, WVTM 13.